Right. So, everyone, my name is Bilal. I'm one of the ST1s in radiology in Nottingham. I've been asked to give a talk on how to enter radiology in 10 minutes. So, we'll see how we go. So just to caveat this talk, this is going to be about how things are at the moment. There are new changes that are being proposed for the 2026 application cycle that have not been finalized yet, but we'll get to some kind of a picture in June to July. So this is how things are at the moment, but they may change a little bit. Right. So the overview of my talk is I'll talk about the eligibility, the application timeline, and also the assessment components, which is going to be the bulk of the talk. So eligibility wise, it's mostly the same things that you need for other specialties. So you need GMC registration, you need the visa, you need to have your CREST form, and the experience limit. So I'll just say a few things about the experience limit. So like other specialties like surgery and radiology, you need to have 18 months or less experience in the field to be eligible for ST1. Now, some of you may have done house job rotations in radiology, and you'll be wondering if the house job rotations count towards these 18 months. So though they do not count towards these 18 months. The HEE have specified that the foundation modules of up to 4 months are excluded from this experience limit. And this experience limit is in any country. So it could be Pakistan, India, or wherever you worked in radiology. It's not specific to the UK. So the application timeline is the applications open in October to November. There's only one round for radiology, so you can't apply it in round two. So it's just one round. February is when you upload the portfolio and you get the MSRA results. March is when the interviews happen, and you get the result for the interview as well as your ranking by the end of March, and then you get the offers by the end of March as well. And August is when the training program begins. So the assessment components are MSRA exam is just for screening. So you need to have a certain threshold score in order to qualify to the next stage, which is 40% of the total score is the portfolio that you build throughout the year, and 60% of it is interview. So interview is quite important in radiology, and we'll talk about that in a minute. So the MSRA exam, there's been a talk about the MSRA exam as to what the exam is, how to prepare for it. I'll just highlight a couple of things about this. So we already know it's a clinical problem solving part, 50%, and 50% is professional dilemmas, which is also called the SJTs. You need to pass both the sections independently, which is about 201 marks in each section. But not just passing the exam is enough. So you need to have a very, very high score to be able to pass that threshold for radiology. So 2024, when I applied, the threshold was 555 marks. So that's quite a high score. And you need to be able to pass that to be invited for the interview. Otherwise, you'll be screened out. And this threshold comes from the fact that the interview, they only pick the top 850, roughly 850 candidates for the interview. So wherever the lowest mark is in those top 850, that will be the cutoff. So it was 555 in 2024. It was around 550 in this year. So it's quite a high score. But then there is also another point to note that the interview positions, so the actual positions for radiology in the UK for first year are approximately 300. So when you see the GMC posting a very scary competition ratio that it's 1 to 13 for radiology, I mean, if you think about it, it's not really that. If you cross this bottleneck, you'll be among the 850 candidates who'll get the interview for 300 slots. So the actual competition ratio that you'll have is with these 850 candidates. So that's approximately 1 to 3, not 1 to 13. So 1 to 13 is all the people who apply to radiology. 850 is the actual people who'll get the interview. So if you cross the MSRA bottleneck, your competition will be with these 850 people. So there are different resources for MSRA. I mean, it's personal preference, but I used MCQ Bank, I used eMedica, and I used Oxford Handbook for the SJTs. So the MSRA exam, even though it doesn't have any aggregate score in the total aggregate, even though in my year it had an aggregate of 20%, but now it's just screening. But even though it's screening, it is the exam that will get you, ahead of the competition versus wipe you out completely. Right. So portfolio. So there is lots and lots to do in the portfolio, and I don't think that 10 minutes is enough to go through a lot of that. But I think the thing that you need to understand is a score of 25 to 30 is good enough. It's a decent enough score. So most people will have 25 to 30 marks, and then a few people will have 35. Some will have 40 plus as well. But 25 to 30 is what you should aim for. I've written down a few things that will get you those 25 marks. So you need to do two taster weeks in radiology, which will give you 10 points. You need to do two radiology audits and complete the cycle, which will give you 7 points. And radiology audits are really quite simple to do. You can go to the RCR website and they actually have the audit templates that you can do. And some of these audits take 5 hours, 6 hours to complete for one cycle. So they're very simple and easy to do. So that if you do two audits, you'll get 7 points. And then if you're involved with local teaching and if you do this course, this is called TTT, which is short for Teach the Teacher course. It's an online course. It's 2 days, I think. It's a paid course, but if you do these two things, you'll get 6 points. So you see that these three things, if you do, which are not very hard to do, you get to 23 points. And if you get to 23 points, then the rest of the things, such as publications, presentations, masters, PhDs, you can do anything you want if you have the time. So you can ramp that score up to 30, 35, 40, as much as you want. But if you get to a score of 25 to 30, I think that's decent enough. The other thing is you need to watch out for November. So even though you upload your portfolio in February, you need to be finished with everything on the portfolio by November. Anything you do after November, once the applications are closed, between November, December, January, will not count towards your portfolio. So that's something that you need to watch out for. And there are some changes that they are proposing for 2026. So they are going to reduce the domains of portfolio from 7 to 5. They're going to merge some things, but we'll get a clearer picture in June or July. That's some changes that they propose to implement. Right. So interview is 60% of the portfolio. So that's like the bulk of your whole effort. If you do well in the interview, even though you haven't done so good in the other things, you might get a position. So it's a virtual interview. It's got two stations. They're 10 minutes each. It's 2 to 3 consultants who are there in each panel. The total score is 60. You need to pass each station independently, and you need to have a minimum of 36 in the whole interview to actually be considered pass. The interview the thing that I want to highlight about the interview is they don't expect you to know a lot of medicine. They don't expect you to memorize Davidson or be, it's not an exam. They're judging a lot of other things. So the bulk of the interview is one of the stations is clinical prioritization. So that is basically they might give you a list of 5 scan requests. So they might say that one scan request is there's an old lady and they want to do a CT head for headaches. The second request is there is an MRI of a young man who's got cerebral paresthesia. The third request is ultrasound. So they'll give you 5 scans and they'll ask you to prioritize on the basis of urgency. And they'll ask you why you prioritize one scan over the other. So that's the bulk of one station. And the other stations are ethical scenarios and communication skills, the things that you've already done in the PLAB exam. So colleague coming in late or a drunk consultant or like if you have a disagreement with one of your colleagues. So that's the other thing. So you can prepare for the interview in the 2 to 3 week window that you get, but you need to practice a lot. And the resources that I use were Radcast and UKRST. The interview panel used to be unaware of your portfolio, but now they are proposing that we put in a portfolio station in the interview as well. But again, we'll know about that in June. So the key takeaways from this that I want you to take away is that do not underestimate the MSRA, please. MSRA is a screening tool, but if you don't crack that, you won't get to the next stage. Interview is the 60% of your whole effort. So if you do well in the interview, you'll get it. Portfolio is something that you do as a booster. So make as much portfolio as you can, but focus on the first two things. So my scores were 557. Portfolio was pathetic. It was 16 out of 45, but my interview was 55 out of 60. So I've written down these scores to just hammer these points. I was barely above the 555 cutoff for MSRA. I had the most crap portfolio in my whole batch, but my interview was good, so I got the slot. So I think, 10 minutes are almost up. So thank you so much for listening and best of luck. This is my email address. If you have any questions, I know there's a lot to cover about portfolio and interviews. If you want to reach out on the email or socials, I don't mind. And this is some websites for your portfolio stuff and the, generally the radiology application pathway. So thank you and best of luck.